All right, today we're jumping into a really important report about the future of nursing. It tackles one of the biggest, most confusing puzzles in American life. And you know what? It all starts with a very, very expensive question.
So let's really unpack this, right? The US pours trillions of dollars into healthcare. I mean, way more than any other nation on the planet. But here's the crazy part. When you actually look at the results, things like how long we live or how safe it is to have a baby, we're consistently falling behind other developed countries. This isn't just some weird statistic, it's a genuine crisis. And to even begin to fix it, we have to be crystal clear about the goal we're so badly failing to reach.
And that goal is something called health equity. Now, the key word you got to hang on to here is opportunity. This isn't just about whether you have an insurance card in your wallet or a hospital down the street. It's about making sure that things like your zip code, your income, or your race don't get to decide your chances of being healthy. It's all about leveling the playing field.
Okay, so we know the goal is health equity. Now let's get into just how big the problem is that's standing in our way. And honestly, the numbers, they're just mind-boggling.
Get this, every single year, the U.S. spends over $3.5 trillion on healthcare. That's a number so huge, it's hard to even wrap your head around. So, the report is very clear on one thing. Our problem is not a lack of investment. The real issue is where all that money is going and what it's failing to get us.
And this right here shows that disconnect perfectly. Take a critical issue like maternal mortality. With all our advanced technology and all that spending, you'd think we'd be the safest place in the world to have a baby, right? Wrong. The U.S. is actually a more dangerous place to give birth than most other wealthy nations. We're paying a premium for far worse results. So what on earth is going on? What are we missing?
Well, the report argues that the giant missing piece of the puzzle is this idea: social determinants of health. Now, it's a bit of a mouthful, but the concept is actually pretty simple. It just means that your health isn't only shaped by what happens in a doctor's office. It's profoundly shaped by your life outside those clinical walls, the everyday conditions of your life.
So think about it like this. All these things we don't normally call healthcare are actually huge for your health. Like, does your neighborhood have safe sidewalks? Is there a grocery store nearby with fresh food or just fast food places? Can you get a good education that leads to a stable job? These factors are either building a bridge to good health or putting up a wall, long before a doctor ever enters the picture.
But this is where the story takes a turn, because the report doesn't just leave us with this massive, depressing problem. It points to a powerful and kind of overlooked solution that's already in place, in literally every single community.
And what is that solution? Nurses. We're talking about nearly 4 million registered nurses in the United States. This isn't just a job category, it's a massive, highly trained national asset. And their sheer numbers mean they reach into every nook and cranny of the country. And to put that 4 million number into perspective for you, nurses outnumber doctors almost 4 to 1. Think about that. For so many of us, a nurse is the first person we see and the person we see most often in the entire healthcare system. That kind of scale, that's a tremendous opportunity to make a real impact.
And that impact comes from their unique position. See, nurses don't just work in hospitals. They're in our schools, they do home visits, they're in community clinics, they are everywhere. This puts them in the perfect spot to be the connectors, the bridge between traditional medicine and all those social support services we were just talking about. So if they're the solution, what's the problem?
Well, the report identifies a whole bunch of systemic barriers. We're talking about outdated rules, regulations, and just old ways of doing things that are basically tying nurses' hands, holding them back from doing this vital work.
A huge part of the problem comes down to how we pay for care. Right now, our system is basically set up to reward volume, more tests, more procedures, more visits. It doesn't really pay for the time-consuming work that actually improves health, like coordinating care, or educating a family, or connecting someone to a food bank. We're incentivizing doing more things, not achieving better health. It's a fundamental mismatch.
And here's a perfect, kind of technical, but really important example of how this system makes nursing work totally invisible. It's called incident to billing. Basically, a highly skilled nurse practitioner can provide all of the care for a patient, but because of the billing rules, the doctor gets the credit. This doesn't just misrepresent who's doing the work, it makes it impossible to measure and value the true contribution of nurses. And the barriers don't stop there. You've got restrictive state laws that prevent nurses from practicing to the full extent of their education and training. You've got nursing schools that are still playing catch-up on teaching students about health equity. And on top of all that, the nurses we do have are burning out from incredibly stressful jobs. It's like the system is fighting against its own best asset.
So, after all those problems, here's the good news. The report doesn't just throw its hands up in the air. It actually offers a solution. It lays out a clear, actionable blueprint for how we can finally unleash the power of nursing.
The plan is pretty comprehensive, and it breaks down into 4 key steps. 1. Lift those outdated restrictions so nurses can practice to the full extent of their training. 2. Change how we pay for care to reward the work of actually improving health. 3. Update nursing education so it's focused on equity and social determinants. And finally, 4. Create work environments that protect and support nurses' own well-being.
And look, this isn't just theory. This isn't some pie-in-the-sky idea. The report highlights some amazing examples of where this future is already happening. Let's take a look at what this looks like on the ground.
Just listen to this quote for a second. It says it all. This is from someone in a nurse-led program called Capable, and it shows that health isn't just about a diagnosis or a lab result. It's about dignity, independence, and being able to live a full life.
So here's how this model, Capable, works. It doesn't just send a nurse to check blood pressure. It sends a whole team. A nurse, an occupational therapist, and, get this, a handyman. They address the person's whole situation. So they might install those railings, fix a tripping hazard on the floor, and help manage medications, all based on what that person wants to achieve. It's healthcare that actually fits the person, not the other way around.
And this isn't a one-off. There are other programs out there like the Camden Coalition in New Jersey. They use nurse-led teams to help people with the most complex needs, the folks who are constantly cycling in and out of the ER, by connecting them to housing, food, and stable primary care. These models prove that when you empower nurses to address the root causes of poor health, you get better outcomes for people and, yep, lower costs for the system.
So we end where we began. The path to a healthier, more equitable America runs directly through its nurses. This report makes it totally clear. They have the numbers, the skills, and the trust to lead the way. The real question it leaves us with is, will we finally remove the barriers and give them the support they need to do it? What role can we all play in helping them get there?